patients as in people coming to seek healthcare, but patience as in having patience as a virtue. And having patience when you are having pain or when you're injured and when you're not able to do the things you want to do is challenging. And I know from experience, as being a patient myself and having pain and having limitations, it is frustrating because we know life is short. We want to do the things that make us happy and that we enjoy, and it's frustrating and not enjoyable to be in pain, and we just want to get rid of this as soon as possible and get back to the way things were. However, the lack of having patience can actually sometimes get us into trouble and cause more harm and prolong what we don't want rather than getting us where we want to be. Because in the nature of tissue healing, when there isn't some tissue injury and the tissue needs to heal and recover, there is a time component with it, and there's no way around it. As of now, there's still nothing that significantly speeds up tissue healing. And basically what we can do in physical therapy and for ourselves is create the best environment, the most optimal environment for tissues to heal. And there are multiple things that go into that. Number one is doing the right things from a rest and recovery standpoint. So a certain amount of rest and refraining from activities that may aggravate symptoms or aggravate tissue healing is necessary. The right types of movement, because we know that early mobilization is very important for tissue healing, but is the right type of movement, not too much, not too little. Adequate sleep is very important. Adequate nutrition is very important. Reducing stress as much as possible, or how you manage stress, is very important. Obviously, there's certain genetic factors which you may not have as much control over, play an important role. So, for example, as if you're not sleeping well and you're eating poorly, so when I say eating poorly, I mean a lot of fried food or fast food, and not eating vegetables and not eating fruit and not eating whole foods and eating a lot of processed foods and other types of things like that, that is going to have a significant effect on your tissue healing, whether you like it or not. Staying in bed, not moving at all, will have a significant effect, a negative effect on tissue healing. Ignoring sometimes what your body is telling you and trying to push through things is also going to have a significant effect on healing and recovery as well. So it's that finding that adequate balance, which is a little bit different for everybody. But as physical therapists, that's part of what we can do, is test things and prescribe things and recommend things and find, working together, that adequate balance that best enables you to recover well and get back to doing the things that you so much want to do. However, we still must be aware of the time component that there is. And if we think about tissue healing, and something we've talked about before, if you cut your finger and have a cut on your finger from just like slicing vegetables, for example, which I tend to do a lot, it'll feel better in a couple weeks. However, it will take about 2 weeks for that skin to heal. And that skin gets a fantastic blood supply, and it still takes about 2 weeks. Muscle, a specific muscle strain, will take maybe 4 to 6 weeks. Bone fractures take maybe 6 to 8 weeks in the upper limb, 8 to 10 in the lower limb, sometimes longer depending on the severity of the fracture, of course. Things like bone bruises, and I have one patient that has a bone bruise right now. It's a very specific type of injury. That can take 10 months to heal. Disc injuries, nerve irritations, minimum can take 6 to 8 weeks, minimum. Much more likely to take several months. It can take even years, depending on the severity. Again, we know post-operatively, like rotator cuff repairs, ACL repairs, can take 8 months to a year, and even can take a couple years for full tissue healing. So, the body does take time. It can heal very well, but certain things will take time. And a lot of things can disrupt that healing process. It's important to try to create that adequate and optimal environment, and that's essentially what physical therapy can do. But the lack of patience oftentimes will lead to more harm than good. So as frustrating as it might be, as much as we can try to implore and urge everybody to embrace the process, it's only through experience that we know that this is how this process works. Regardless of gimmicks out there and promises out there, the fact is, under scrutiny, both from anecdotal patient reporting and from the scientific literature, those things just don't hold up. And in some situations, sure, do some people get these very quick results? Yes, but those are the exceptions and not the rules. Most people, it's about going through the process, and we try to make that process as quick as possible, because believe you me, I want to get people better as quick as possible as well. But sometimes there are certain situations that take a little bit longer. A little bit longer than I wanted to go today, but hope everybody has a great Monday, a great start to the week, and I'll look forward to talking to you guys tomorrow. Bye.